All right, so the recording's been started. And I'm gonna hop in and go through here. So thank you all for being here that are in person. This is going to be the open enrollment overview for going into 2026. So first off, appreciate everybody's patience. There are a lot of decisions that were made this year just to continue to try to offer the program that the county's had in the past, continue to give you the options and the plans that have been enforced. And I got to thank the healthcare planning committee meeting and everybody that was involved with it because a lot of work went into it. But starting off, I've got the benefit guide overview here. So I know June's already shared this. For some of you in the room, you've got it. I'm going to be walking through this in more detail just to highlight, all the different pieces that go into the plan. To start, there are no changes per se in terms of the carriers that we're utilizing today and our coverages. Some things that we'll be highlighting that have slightly changed are the medical plans, but all the other benefits are going to stay the same. No changes just in terms of cost or plan. So starting off, when you have your benefit guide, again, this just is, I'd say for all of you, kind of your encyclopedia in terms of the Oak County benefits program. Has detail just in terms of all the different benefits that are offered, more information in terms of how the benefits work, contact information, or so on. But if any of you all ever have any questions, you can always get in contact with June, the HR team, get in contact directly with the M3 team that supports you all. On here, though, you also see information in terms of your carriers. If you ever need to reach out directly, obviously for you that have, medical insurance, so on, you've got your ID card. There's the number on the back that you can always call, but a lot of helpful information within this guide to keep handy. So starting off, first thing, so for all the benefit eligible employees, the elections that you're making during this open enrollment period are going to go into effect January 1, 2026. So ADP is going to be up and ready to go in and make your elections. We are going to need you to go in there, and within ADP also, you're going to be putting in beneficiary information. This is that one time during the year where you can go in and make these potential changes to set up and go into place for 2026. One thing to really just note, one change that's happening. So for 2026, all of the benefits are going to be taken out on a 24 periods deduction. So just if you've got any questions or what that's going to look like, that is going into effect in 2026. And just to really try to make things a little more streamlined, simpler to administer within ADP for the county. So first piece, medical plans. So for 2026, we're going to still be with Blue Cross Blue Shield of Illinois. We're going to offer the very similar 3 plans that we've had in the past. I'm going to go into what's changed in 2026. And, for you all, there's really not a big change when it comes to the benefits. It's just some of the things that are happening more so behind the scenes in terms of how it's being administered. So just like your benefit elections go into effect January 1, 2026, your deductibles, that's also when it resets on that calendar year, as well as your out of pocket and so on. So in here, it's got terms of just, some of the plan design details. But this next page, this is what we wanted to spend time on, talking about the 3 plan options that are in place today for the county, and will continue to be in effect in 2026. So for all of you today that are on the medical plan through the county, you have 3 options you can choose from. There's the $0 deductible, the $1,000 deductible, and then the high deductible health plan, which is HSA qualified. First off, I will say, in terms of when you look at the benefit offerings on the medical side for the county, you have, I'm sure very, very generous plans. The average deductible in 2026 for employer-sponsored plans is almost $2,900. So the fact that you have a $0 deductible on the large PPO network with Blue Cross, frankly, you can't have a richer benefit plan if you want it. But on here, one thing that you're going to see change in 2026 is up top here, it shows the plan deductible. So starting with plan option 1, you see that plan deductible, $250 for an individual, $750 for a family. You go in network. Underneath that, it lists out employee deductible and lists 0. So for all of you that enroll on this plan, you will still have a $0 deductible on this option. The difference that is happening is, one thing, when you're fully insured with Blue Cross like you are today, your plan design doesn't necessarily just continue to roll over year after year after year. Your plans get mapped over to new product portfolios. Basically, Blue Cross has about 100 different plan designs they offer, and you get mapped to whatever is the closest matching plan. So in 2026, the $0 deductible plan you're on today is no longer offered through Blue Cross in 2026. However, we still want to give you that $0 plan like you've had. And what's happening is we're purchasing this $250 deductible option, but the county is going to fund that $250 deductible to something we call health reimbursement arrangement. So I'll talk about that in a little more detail in terms of how that works. Really, there's nothing that you have to do or are going to be concerned when it comes to that $250 deductible, but this is something that's happening behind the scenes. And that $250 deductible is being 100% funded by the county. Okay. So when you look at plan option one, you've got, preventative care services for all the medical plans are covered at 100%, no copay, no deductible. But let's say that I'm going to go see my primary care. I'm going to go see a specialist. I'm going to pay that applicable copay. So for a primary care, $25, for a specialist, $50. I pay that copay. That visit is then covered in full. In an instance, though, that I go to see my primary care, I have a follow-up, I've got to go get lab work, I've got to go, for other follow-ups, whatever it might be. Those are the services that go towards that deductible. So again, those are the services that are going to be attributed or applied to that $250 deductible. However, again, that full $250 deductible is going to be funded by the county. Outside of that deductible, once that $250 portion is set, the plan then pays 80% coinsurance. You're responsible for 20%, up to a total out-of-pocket maximum of $1,000 per individual, just like it is on the plan today. So if I got myself and my spouse on the plan, we'd each have our own $1,000 out-of-pocket maximum. Maximum we would spend as long as we go with those network providers would be $2,000. If I've got myself, my spouse, and my 4 kids on the plan, we all would have our own individual deductible or out-of-pocket maximum $1,000, but it's going to be capped at that $3,000 number. So if you've got family coverage, even if you've got 4, 5, 6 dependents on the plan, you're capped at that $3,000 threshold. Okay. Any questions on how that plan works? So again, that plan's staying as close as possible to the plan that you have today. And again, that's a plan that includes copays for office visits, prescriptions, so on and so forth. The second plan option is the current $1,000 deductible plan. So as you can see here, the deductible that we're buying from Blue Cross to match as close as possible is this $2,750. You're still only responsible for the $1,000 of it. After you've satisfied those $1,000, the county is going to fund the remainder of that deductible. Same thing on this plan. You're going to pay those copays for services, prescription drugs, and so on. Then that's covered in full. Anything outside of that is going to be what goes towards that $1,000 deductible. Okay. After you satisfy that $1,000 deductible, the plan then pays 90% coinsurance. You're responsible for 10% of it, up to a total out-of-pocket maximum of $2,000. Again, matching the structure that you have today. So exact same that we just talked about with the $0 deductible plan. The $1,000 deductible plan is going to be very, very similar to what it is today by utilizing the HRA. Okay. And then the third option is going to be the high deductible health plan. So for anybody that's on the high deductible health plan, that is a HSA qualified plan. So because the plan does not include copays, everything goes towards the deductible. You're able to contribute to a health savings account. On this plan, structured to per the IRS minimums and as closely matching as your plan today, it's a $7,500 deductible that the county is buying. However, you're responsible for just the first $3,400 of it as an individual. Anything after that $3,400 is going to, again, be funded by the county. As I mentioned with this plan, it's a little different. It does not have copays. So anything out of preventative services, even when you're going and picking up prescription drugs, you're going to pay, and it's going to go towards that deductible. Once you satisfy your deductible amount of $3,400, everything is going to be covered at 100%. And if you have additional family members, each of you are capped at that $3,400 level up to a maximum per family of $6,800. Okay. Any questions on any of the 3 plans?
I do have a question on the first plan.
Yeah.
You say it's the $0 deductible, but then there's $1,000 out of pocket. What is it? Can you explain that to me?
Yep. So the way the medical plan works is you're first responsible. So outside of the copays, like we mentioned, right, you're going to have to satisfy your deductible. So you're going to be responsible for, in this plan, up to that $250. Again, the county's funding that $250. After the deductible is satisfied is when it then goes into that cost sharing arrangement. So whenever you hear the term coinsurance, that's where it says with this plan, 80% of it, any additional dollars after that deductible satisfied, the plan's going to pay 80%. You're going to be responsible for 20%, up to a total out-of-pocket maximum of $1,000. So in this, if we had, after you satisfy your deductible, you go and you have a $100 claim, the plan would pay $80 of it. You would pay $20 of it, and it's going to all go towards that $1,000 out-of-pocket maximum. Also, all your co-pays that you're paying throughout the year accumulate to that out-of-pocket maximum. So anytime you're going and picking up a prescription and it's a $10 copay, that $10 goes towards your out-of-pocket maximum. You've got $990 left that you got to satisfy. Does that make sense?
That makes sense.
Yeah, absolutely. So again, the three plans that we're going to continue to offer. Yeah, go ahead. So the deductibles are all set as individual levels. So each individual family member has. Nope, for employee plus one, it'd be $2,000 for the zero plan. For the middle plan, it'd be $4,000. And then for the high deductible plan, it would be the same as the family because it's 2 times. Okay. So one thing to note, just when you look at contributions and premiums that you all are going to pay, there is a slight increase for 2026. The vast majority of it is being funded by the county. And also to be able to keep the plan as rich and as similar as they are today, we're also implementing this HRA and funding 100% of that. So when you look at what you're paying today versus what the contribution is going to be in 2026, it's right around, I think, like a 5 or 6% increase to you all in terms of your contribution amount that you're going to be paying. Okay. So again, if you stay on the exact same plan at the same tier, it should be a pretty small change in terms of how much you're contributing on a monthly basis. Yeah.
And then we also have to take wellness to get contract.
Absolutely. Yep.
So if you're a
Yep. Yeah. And again, the wellness program, if you're taking advantage of that today, highly encourage you to do so in 2026. If you've got questions on that, obviously let the team know and we can help you. But yeah, a great way to save money when it comes to contributions. Okay. So again, there's changes happening with the medical program, but in essence, the plans are going to be as close as they possibly can be to the exact same plans you're on today. And it's all still accessing the exact same provider network. So as long as you're going and seeing those in-network providers, which if you've ever got questions on a provider, a facility, you're going to get services, let us know. You can call Blue Cross, but whatever we can do to make sure that you stay with those in-network providers that we really want to do. Okay. All right. So the next piece, I had mentioned the HRA, and there's a lot of detail on here that, frankly, you're not going to have to worry about. The one thing I want to just really call out is with this plan, when you think about how the HRA works, when you go to see a provider, right? A lot of times you're going to have to pay that office visit copay at time of service. But when you have those additional services that would apply towards the deductible, those are typically not going to be paying at point of service. You're going to provide your insurance card, you're going to see the provider, have whatever services done, and then after the fact, you're going to get that explanation of benefits in the mail, right? Here's who received care, here's who they saw, here's what the potential cost was, here's what you may owe. It's not a bill, but it's giving you an explanation of what that benefit is. After that EOB is generated, typically then that's when you're going to get that bill. With the way the HRA works with Envision is going to be the administrator of it, is they are actually paying the provider directly for any of those services. So if you're on, let's just call it the $250 deductible plan, right? And you have a $0 deductible, any deductible eligible services would go through that process. You would get an EOB, but you should never get a bill from the provider. That EOB is there's an integration that happens between Blue Cross's claim system and Envision. And if they see that, oh, here's a member that's on the $0 deductible plan, there's a $250 deductible charge, we're sending that $250 payment directly to that provider. So you don't have to get reimbursed and then pay the provider. It's all happening behind the scenes. And it truly is the most seamless experience we can provide when it comes to this HRA arrangement. So you're still able to set up an account. You can see where you're tracking in terms of how much have you spent, how much has been funded by the HRA. There'll be more detail on that packet. But the one thing that you just keep in mind, there's really nothing that you have to do. So if you're on the $0 deductible plan, You should never be paying any deductible. If you're on the $1,000 deductible plan, after you've satisfied your $1,000 portion, everything else is going to be funded by the HRA.
So with this, you should not be getting a bill from.
Should not be getting a bill. Now, a bill may still come. And again, if you're on like the $1,000 deductible plan, right, you're going to have to still pay that first $1,000 deductible. But after you've satisfied your responsibility, 100% over that is going to be funded by the county through the HRA. Yep. But once they've satisfied their deductible portion, depending on timing, because again, when you go in and get a service, that bill doesn't get generated that minute. But typically, depending on how that integration works and timing wise, Envision should be able to intercept any type of bill, pay that provider directly, and there's nothing else that you have to do. So I know it's different and it's new, but again, this is out of all the clients I work with, Envision is the one administrator that I put in these types of programs because there's a lot that are out there. I strongly feel that Envision's by far the best. And again, this is to try to make it so you don't have to do any additional work. HRAs, this type of process has been around for a long time, but it used to be very manual. You would have to show your EOB, you would get processed a payment, you would still have to go back and pay the provider. With how we've set this up, it's really taking all that work off of your plate and Envision processing it all behind the scenes. Okay. All right. I mentioned earlier the high deductible health plan. So with the high deductible health plan, that is eligible to establish a health savings account. So that's tax-free dollars that you can put into a health savings account to pay for eligible healthcare expenses. This is a great savings vehicle. Again, you're only eligible for this plan if you're on the high deductible option, but a great way to use pre-tax dollars to pay for healthcare services. So when you look at what you're paying in premium today, how you utilize the plan, whether you're a low utilizer, high utilizer, whatever it might be, the high deductible plan can be a really good option for some of those folks that want to take advantage of, again, using pre-tax dollars to pay for those services. And you can contribute up to $4,400 as an individual. That's also lowering your tax deductible income. So the HSA, if you've got questions on it, this is going to continue to be administered through Health Equity, but also any dollars that go into a health savings account, that's your money. So whether it's retirement, you move, change jobs, whatever it is, anything in that health savings account is your money. It's going to go with you. Also, it's not just for medical coverage. So, you can use it to pay for prescriptions, deductible expenses, whatever it might be. You can also use health savings account dollars to go towards things like glasses, dental services, even going and buying sunscreen at the pharmacy. There's a lot of HSA eligible type items and purchases you can make. The flex spending account, this is also a tax advantage program, and this would be tied to that $0 deductible or $1,000 deductible plan. So because those plans have co-pays on them, they're not eligible for a health savings account, but they are eligible for a flex spending account. So again, same concept. You can take those pre-tax dollars, set them into the FSA, and then pay for those services, again, with tax-free money. One thing different than the FSA is it is in some ways a use it or lose it type benefit. So when you enroll in the FSA, you have to make the election of here's how much money I'm going to put into it in 2026. You then are able to use that fund throughout 2026. If at the end of the year, you haven't used those dollars, there's a way to, again, you get a slight carryover amount, I think $680, but really you want to make sure that anything you're putting in that flexible spending account, you're going to be using and spending in 2026. You are able to submit those expenses until the end of March. So for anybody that's already on the FSA, if you've got funds in 2025 that you haven't used yet, you've got to use them during this calendar year, but you can submit them for reimbursement up until March 31st, 2026. For the elections you make this year, if whatever you put in 2026, by the end of 2026, if you haven't used those dollars, again, or if you do use those dollars, you have until the end of March 2027 to get reimbursed for anything you put in there. So a little different with the flex spending account. If you haven't used it in the past, maybe be a little more conservative in terms of how much money you put in there. But I'll just, I'm somebody that's utilized a health savings account, a high deductible plan for probably the last 20 years. I've worn the exact same contacts for the last 20 years. I know exactly what they cost. I put that money into a health savings account and I buy my contacts with pre-tax dollars, saving myself 25, 30% versus playing with post-tax. So a lot of ways to take advantage of these tax advantage savings options. Any questions on the FSA or HSA? Only other thing I was going to say is also dependent care FSA. This is another benefit that's offered. This would be for anybody that has eligible child care, or if you have eligible elder parent care, you can also put pre-tax dollars into an established fund to pay for those services. And that maximum you can put in 2026 is $7,500. So for anybody that's paying for daycare or potential elder care, a great way to save money on that type of care. On here, there's a worksheet that you can go through. Again, this is just a way to think about, how have you utilized the plan in the past, and maybe giving an idea if you haven't used it before, how much would you want to budget to put into that flat spending account? Again, Health Equity is the administrator for both the HSA and the FSA. So as soon as you do start contributing those dollars, setting up your account, super simple. Again, for those services as well, you get a debit card that you can use at time of purchase. So you have that available. If it's an eligible expense, you can use that card and it pulls directly from whatever you've contributed. And again, more detail in terms of the portal login and so on. All right. So regarding the medical options, one thing we just want to highlight a lot is what are all your care options? So your plans with Blue Cross also include virtual visits. That's through MD Live. So for anybody that's taken advantage of it in the past, that's a really simple process. I'm somebody, young kids, instead of going and sitting in the urgent care or the emergency room for something like an ear infection or, something where we think they've got the flu, use MD Live, those virtual visits. They'll be able to, again, diagnose if there's a prescription that has to be written. They can give you that prescription, send it to your pharmacy, and you don't have to go wait 2 hours in an urgent care facility to get that done. It's also going to be much lower cost to you on those plans than that urgent care copay or emergency room copay. All right. The next piece, these are more just kind of informational pieces, but I'd say really important. So for anybody that's on the Blue Cross medical plans, how many of you already have that Blue Access for Members account set up? Okay. Blue Access for Members, it's basically your member account with Blue Cross. It gives you a ton of valuable information, one, tracking where you're at in your deductible, looking at providers. There's additional resources and tools in there. Any past prescriptions you've bought, any past explanation of benefits. It's basically all the history that you've ever had on the Blue Cross medical plan for you and your dependents in one really simple spot that you have access to. So if you're on the plans, I'd highly encourage you to set up an account. Really simple process. There's a QR code within the guide that you can use to establish as well. I'm on here, as I mentioned, this is where you can go in, pull claim summaries, look at providers, see where you're at in terms of meeting your out-of-pocket maximum, all those great types of services. Also, I mentioned earlier, virtual visits. So again, if you're somebody that wants to take advantage of that program, there's a really simple way in terms of how you can establish your account, more information in the benefit guide here in terms of how you can access. And then when you are a covered dependent, has to have that virtual visit. Really simple process. You log in, there's a mobile app as well. You establish the time and typically they can see you within 20 minutes to a half hour. I included some information here in terms of the pharmacy. So Blue Cross Blue Shield is the medical insurance provider. Prime Therapeutics is the pharmacy benefit manager. So their information is on your ID card as well. But anything that's going through from a pharmacy perspective is going to be tied into Prime. You don't necessarily have to set up this account. I say this probably is, has more application if you're on the high deductible health plan, because on the plans, if you're on the $0 deductible or $1,000 deductible, you have a set tiered formulary that you're paying, whether it's a generic brand, preferred brand, non-preferred brand, you pay that copay when you go to the pharmacy. When you're on the high deductible health plan, there's a discount that's provided to that prescription. However, you're paying for the cost of that prescription. And the one thing that you'll see, and is very interesting, is the cost of that prescription can be very different depending on what pharmacy you go and pick up that prescription at. So whether you're going to Walgreens today, or maybe you go to Walmart, there can be a drastic difference in terms of how much you're paying for that prescription. So within your guide, there's more details in terms of how you can do some shopping to look that up. In the way, save yourself some money for getting the exact same prescription. But again, if you're on the copay plans, regardless of the participating pharmacy you go to, you're going to pay that same copay for that prescription. Again, like I said, the cost savings tools you can use to look up those prescriptions. Also, for all the plans that are offered, you have the ability to take advantage of mail order. So that's where you can establish, and this is through Express Scripts, to get the eligible medications that can be provided via mail order, the exact same prescription that you're taking today, a 90-day supply, delivered to your front step instead of having to go to the pharmacy to pick it up. So again, way to really save yourself some time, convenience. Not all prescriptions are eligible for mail order, depending on, their use, purpose, storage, so on and so forth. But if you've got a maintenance medication that you're taking today, you're going to be taking in 2026, you want to set this up, it's a super simple process. And more detail in here in terms of how you can do that as well. All right, so that's all the information on the medical. Any questions for folks in the room? Again, we're adding that HRA, so there are some changes that are happening, but for the most part, everything is going to continue to be exactly as it is in 2026. One thing that will happen is you will get a new ID card. So because we're moving over to these new plans, you'll have a new ID card with the appropriate plan that you elect. Just from a timing perspective, a couple things I would say is, one, if you know you've got a prescription that you're going to need, get it filled before the end of the year if you can. If not, don't worry about it. In terms of getting those hard copy ID cards, I can't guarantee you'll have them by January 1st, but what I can guarantee is that you'll be loaded in the Blue Cross system. And if you have to go see a provider or do anything like that, you're going to be able to go do that and they're going to be able to find you in their system. There's also temporary ID cards that we can provide. So if you know that, hey, I've got something scheduled for my kid on January 2nd, let us know. We can pull a temporary ID card so you've got it. But ideally, as soon as open enrollment gets wrapped up, all the elections are going to go to Blue Cross, and then those ID cards are going to get generated and sent out. So just putting that caveat out there, you might not have the hard copy ID card by January 1st. But if you've got something coming up or you've got questions, let us know. We can help kind of coordinate all that. And again, if you've got a prescription that you're waiting on and you can get it filled in 2025, I'd encourage you to do so. All right, next piece, dental plan. So no changes to the dental plan offered. So we're going to still be using Blue Cross Blue Shield, that same provider network. And in terms of the benefit options that you've got, same exact type of benefit design. So with this plan, just like we talked about on the medical side, take advantage of those annual cleanings and exams. You get 2 of those covered at no cost. So if you're on the dental plan, take advantage of them. Anything that falls outside of those preventative exams, that's then going to, you don't have a deductible that you have to pay. But if you have to go and get that, let's say a filling, that's when the plan is going to pay 80% of that cost. You're going to be responsible for 20% of it. And that's going to go towards that $1,200 annual maximum benefit that you'll get from the plan. So most plans have $1,000 max benefit. You guys are at $1,200. And again, all those preventative care services, cleanings, exams, so on, covered at no cost. When you can go to an in-network Blue Cross provider, it's going to stretch that $1,200 further. However, whether you go in-network or to a non-contract provider, you still have that same $1,200 amount of money you've got. It's just that $1,200 is going to go further when you can go to participating providers versus not participating. This is funded through the county, so there is not a cost to employees. I believe there's that caveat in terms of if you were opting out or if there was going to be any potential payment from that standpoint, then you wouldn't be on the dental plan. But again, no changes in 2026 for the dental offer. All right, vision plan. So this is offered through Blue Cross Blue Shield as well. The network this utilizes is IMED. So a little different than what we just talked about with dental. If you're on the Ogle County Vision Plan, really got to make sure that you're going to those participating providers. When you go to participating providers, you're going to pay that $10 copay for an exam. That exam's covered in full outside of if you have a contact lens fitting. You're also going to get that full $130 allowance to go towards, again, either contacts or frames after you pay that $25 copay for lenses. If you go out of network, it's going to be a much lower reimbursement level. You're not going to have access to that full $130. So if you're on the vision plan, really make sure that you go to those network providers. There's more detail in terms of how you can look them up. But if you've got questions on that, certainly we're here to help and answer any questions there. As I mentioned, just like you have on the medical side, you can also set up this vision account. That'll give you access in terms of, hey, where are you at in terms of the last time you had an exam? Are you eligible to go get another? Where are you at in terms of your $130 allowance or so on? But yeah, just a really helpful way to set up that account and have more insight in terms of how you're utilizing it. All right, so that's the medical, dental, vision. Again, no changes to dental or vision. Also, the other plans we're going to talk about here, there are no changes. So everything that we're going to discuss going further, there is no change in 2026 from a cost standpoint. When we think about employer life insurance, so again, this is something where when you go in to look at additional plan options, if you wanted to buy voluntary life insurance, this is that time during open enrollment where you have the ability to go in and do so. If you're already enrolled in the voluntary life insurance, that's automatically going to roll over for you. No changes needed. But let's say, for instance, last year I enrolled and I only enrolled in $50,000, and I've had some changes just in terms of what I need to support for. I want to increase my life insurance amount. This is that time during the year where you can do so, and also during this time you can increase it by $10,000 with no questions asked. So typically, after you fall outside of that guarantee issue period, or when it's first offered to you, if you want to increase your coverage, you have to go through evidence of insurability. It's a really simple process. It basically asks you some questions. Based on your responses, it either gets approved, denied, or they ask for more follow-up information. During this open enrollment window, though, this is when you can increase your coverage by, again, that $10,000 amount, no questions asked, up to that guarantee issue amount, which for employees is $100,000. If you're on the coverage, you can also enroll your spouse. They have up to a $25,000 guaranteed issue that would have been offered when you were first offered the insurance. But in order to have your spouse on the plan, you do have to be enrolled as well. And then dependent children, they're able to be enrolled at $10,000. No questions asked. That's automatically guaranteed. The life insurance is age banded. So again, it's going to be based on your age as of January 1st. And then depending on how much benefit you want to purchase, it's going to show you that applicable rate based on your age. Again, this will be within ADP. So when you go in and enter whatever that amount is, it'll do that calculation for you. But if you've got questions on it, you've been thinking about increasing it, whatever it might be, if you, this would be that time to do so. And again, kind of walk through that process. All right. Also going to talk about some additional voluntary plans. So these got rolled out last year, or I should say this year. But these are really just additional supplemental benefits that you can have in addition to your medical insurance. So the first one being accident insurance. This is a benefit that does exactly what it says it does. If you suffer an accident, it's going to pay you out a set defined dollar amount depending on the care that you had. So for instance, if you suffered an accident, there's an ambulance ride, there's an emergency room stay, there's a surgery, you're going to get paid out a defined amount for all those different types of services. I'll tell you, this year I broke my arm. I had an accident insurance plan. It paid me out $4,000. So it, in essence, paid for my deductible by having that plan in place. I've also got kids that typically there's usually an emergency room visit at least once a year with one of them. And usually it's due to an accident. Also get paid out on that benefit, assuming you enroll your children. So you can see here what those monthly premiums are if you'd like to enroll, because we do know a lot of times, even though the medical plan is going to be that main driver of paying for those services, there's still additional out-of-pocket costs that you incur. Accident's a great way to help protect yourself in those instances. So as I mentioned, this shows you kind of the detail in terms of what those dollar amounts would be paid out depending on all the care that was received. Also, this plan includes a $50 wellness benefit. So that's one thing I forgot to mention. There's more detail in here as well. But if you satisfy, like for instance, if you're participating in the wellness program and you go and you get an annual physical exam, there's a whole list of additional covered tests. As long as you get that exam or covered test, the standard is going to give you $50 to go towards paying these premiums. So for instance, if I'm employee only today, I've got a $9.51 premium that I paid. If I qualify for the wellness exam, I'm going to get $50. Basically, I've got 5 months of the coverage paid for myself. Okay, so if you are on these plans, take advantage of that, the wellness exams. Another voluntary offering is the critical illness. So again, very straightforward in terms of this is a benefit that pays you a lump sum dollar amount if you are diagnosed with any of these covered conditions. So whether that be heart attack, carcinoma, stroke, so on and so forth, you're going to get paid out a lump sum benefit. So employees, you have the ability to elect in $5,000 increments, $5,000 up to $30,000 in coverage. And that coverage is guaranteed issue. So the date of diagnosis would have to happen after you're enrolled on the plan. But again, just like we know with those accidents happen, when you get a serious illness like this, there's a lot of cost that goes into it outside of what your medical plan is paying. This is a lump sum dollar amount to help you and your dependents when you're going through that tough time. Spouses are also eligible to be enrolled in this plan at 50% of the employee or up to 100% of the employee amount. But you'd have to be on the plan to be able to enroll your spouse. And during this open enrollment window is when you can do that guaranteed issue, no questions asked. And then lastly, there's the hospital indemnity insurance. I really look at this as a plan that can be kind of parlayed with the high deductible plan. That's the one that's HSA qualified. So a lot of times when we know that you have a hospital confinement or stay, again, there's a lot of additional dollars that go into those types of situations. With this, it's paying you a set dollar amount if you get admitted to the hospital. One thing I would know with this is for anybody that might be expecting to have a baby, maternity does fall into this in terms of a hospital admission and stay. So if you got that coming up, it'd be a really good plan to get on. But on it, as you can see here, you get admitted. There's a $500 benefit paid to you. Each day that you're in the hospital, you get an additional $100 paid. And if there's something like a critical care confinement, that gets paid out $500 as well. So just, again, additional dollars to help offsetting that deductible cost that comes when you get stayed, when you have a hospital stay. I mentioned earlier that wellness benefit. So on here lists a lot of the tests that can be done. Again, for any of you that are already getting one of these visits, or if you are and at least having that annual physical wellness exam with your provider, that's going to qualify for this wellness benefit. So if you're on any of those supplemental benefits we talked about, if you're on all three and you do one of these tests, you get $150 to go towards paying towards all those different benefits, $50 per. And then lastly on here, the holiday schedule for 2026 is in here. So again, just handy piece to have, see what those dates look like. And then lastly, for anybody that might have some, trouble falling asleep, you do have your required federal notices in here. Just letting you know what other insurance companies are doing with access to your data, following HIPAA laws and so on and so forth. So a lot of information there. Any questions I can answer? Got it. So I would just say, on the lookout for ADP, going in there, making your elections. We've got a set end date until when you can go in there and do it. But if you want to keep everything exactly the same, we do still need you to go in there because you're technically going to be enrolling in a new plan. And also it's a great time that if you got beneficiary designations, so on and so forth, getting all that updated and taking a look at it.
26 next year, that's on our plan.
Mm-hmm.
And that is a life qualifying event.
Absolutely.
Just contact HR and.
Yep.
Get it going. Okay.
Yep. If she knows, she knows when her birthday is. So I would say, yeah, just give them a 30-day heads up that, hey, this is happening, and they'll be able to get ready on it. Of course. So I again, really appreciate you all taking the time here. I'll stop the recording.